Good evening, everyone, and welcome to our Viva team member COVID-19 vaccine question and answer session. Some of you have already submitted questions to your community directors earlier this week, and we will try to answer those this evening. If you do have new questions, though, please ask them by typing into the Zoom chat box. And once our guest speaker completes his presentation, we will then try to answer the questions that were submitted earlier, as well as the ones that we received tonight, as time permits. Naturally, if there's any questions that go beyond that time, we will certainly do our best to get you those answers later on this week or next week. Speaking of our guest presenter, we're very fortunate to have Dr. Noah Ivers join us this evening. Dr. Ivers has an impressive set of credentials, including family physician at Women's College Hospital, scientist at Women's College Research Institute, Innovation Fellow at Women's College for Health System Solutions and Virtual Care, and Associate Professor at the Department of Family and Community Medicine at the University of Toronto. Dr. Ivers is also providing support to ORCA, the Ontario Retirement Communities Association, regarding the vaccine rollout to retirement communities. So, without further delay, here is Dr. Ivers.
Thank you kindly, Danny. I've been doing a lot of these talks trying to help answer people's questions about the vaccine, and one never really does get used to being introduced. It's a bit bizarre, but I'm hoping folks will feel comfortable to ask questions. I'd ask you, I guess just because things can get a bit unwieldy on Zoom, not to interrupt me, but if we were in person, I'd say just interrupt me anytime. I'm an informal person, and I think, these are personal decisions that I'm trying to help everybody make. So we'll try to keep it somewhat informal, but I'll start by showing a brief slide deck that offers a chance for me to give you the information I think you ought to have about the vaccines. And then we'll get into our conversation. Thanks, Danny. So that's me. I hold a Canada Research Chair, which is sort of the government of Canada funds me to be like a scientist. And a few days a week, I also run my family practice at Women's College Hospital. I'd love to get to know all of you better, but we don't really have time for roundtable introductions, unfortunately. So let me get started. Yeah, so I think the first thing I want to say is that having concerns is completely natural. If you didn't have any questions at all about the vaccine or the vaccine rollout, that would be strange. There are some common concerns that we are hearing all the time as we go and talk to people about the vaccine, the rollout plan. Some people believe that they're not at risk of COVID-19, so they're not sure why they should bother getting vaccinated. There are many people that claim that the vaccine is still experimental. Often I hear the word rushed being used. I hear people concerned about side effects or long-term effects, and frequently I hear concerns about DNA. Over the next 10, 15 minutes, and through the questions that we have together and answers afterwards, I hope all of these things will be responded to in a way that you feel more comfortable, that you feel like you could even explain the answers to your family members, to your friends that you interact with on text or on Zoom yourself. Okay, let's go to the next slide. So before we dive deep, I think it's important just to take a moment and pause. Think to yourself, when I heard about the vaccine was coming, what really worried me about it? And also, what have I been worried about in terms of my health during the pandemic in general? And I think any decision requires us to be honest about, where we're coming from and what reasons we have to trust or not trust different kinds of information. And I think it's important to be honest about that sort of stuff. So check in with yourself, try to decide where you're coming from. Then hopefully we can find common ground over these next few minutes. Let's go to the next slide. All right. So I often hear questions about, why staff in long-term care and retirement homes first. And I think in order to answer that, we need to reflect on three things. First, we can all see how COVID-19 has affected us. The very fact that I'm giving you this talk on Zoom is just one small, tiny bit of it. You know, my kids are having homeschool. You know, my kids can't interact with my parents, which is the most crushing thing. I, you know, have to think twice about everything I do with my patients. The whole world is different, and we're all, I believe, keen to get back to normal. So I think that's really important to keep in the front of our mind. I think it's also really important to keep in the front of our mind that you guys are doing like the most, you are the most essential workers out there. You are the ones making sure that our most vulnerable seniors remain safe and well. And so, you know, I lump you together with the folks working in long-term care homes, although those homes are of greater risk than retirement homes. There is no doubt that people living and working in retirement homes are at higher risk of COVID-19. And we're all relying on you to do your best with PPE and to keep the residents safe. And there's no doubt, as to point 3, that your friends and family want you to stay safe and that they're worried about you. Honestly, I mean it. And that's why I'm spending so much time reaching out to all of these communities of people, is that I really think that you guys are the unsung heroes in the pandemic. And actually, that's the bottom line about why you ought to be vaccinated first, is that you put yourself on the front lines and you continue to. And what's more is that if you get sick from COVID-19, that puts all of our residents that you care for at risk. And so that's the rationale for why retirement home staff up front along with residents. Let's go to the next slide. All right, let's dive deep into how the vaccines work. Many of you would have heard on the news about the COVID-19 virus and the so-called spike protein that lives on the outside of the virus. This spike protein is very, very important. It is, first of all, quite unique aspect of the COVID-19 virus. Other viruses don't have this special spike protein, so it's kind of like a signature. Now, I spent a lot of time talking about the spike protein because it is the signature of COVID-19 virus, we get to take advantage of that fact when we come up with a vaccine. The spike protein on itself, on its own, is harmless. But if our immune system learns to recognize a spike protein, then it will be ready to fight off COVID-19 virus anytime it sees it, because every COVID-19 virus has the spike protein. What the mRNA vaccine does is it gives our body the ability to produce a few spike proteins. When our body sees the spike protein, it says that shouldn't be here, and it creates an immune response. Whenever it does that, it creates memory to look out for spike protein later. And thereafter, you will be protected because your immune system is ready to fight off any virus that comes its way, any COVID-19 virus. So this is a way to produce natural immunity, our own immune system be ready for COVID-19. I think it's really important to realize that mRNA turns into proteins, like a normal proteins, not the spike protein, because that's a foreign thing, but every moment of every day, mRNA is being used to make protein in our body. It can never affect our DNA. Things don't go that way. They only go forward. So DNA is used to make mRNA. mRNA is used to make protein. It's a one-way street. So there is no possible way in humans for mRNA to affect DNA. And the mRNA that's used to make the protein that is the spike protein to get our immune system ready, it actually will dissolve within minutes to hours, as will the spike protein. So as soon as the immune system sees it, the spike protein will be dissolved and the mRNA will dissolve as well. So in terms of long-term effects, the actual, the technology used here is quite ingenious because there's no lasting effect other than your own immune system. We'll talk a little bit more about that in the next slides, but I hope that sort of makes things a little more clear about how it works. Next slide. Okay, so how well does it work? Well, what's really interesting is that both of the mRNA products that are out now, the one by Pfizer and the one by Moderna, they both work almost the exact same results, about 94, 95% effective from preventing you from getting sick from COVID-19. Doesn't matter how old you are, what race or ethnicity you are. They looked at all those groups. The effectiveness was about the same, no matter what they looked at. And what's really remarkable about this is that they tested in the Pfizer trial well over 40,000, close to 44,000 participants. In the Moderna trial, above 30,000 participants. So we have over 70,000 participants in the last year that were tested with these vaccines. And that is the number they came up with in terms of how well the vaccines work to prevent you from getting sick from COVID, 95% reduction. So that's pretty amazing. Nothing in this life is perfect, but 95% is pretty damn close. Let's go to the next slide. For sure, as important as whether it works is whether it's safe. Here's what we know from looking at those 70,000 volunteers who put up their hands saying, yes, I'll help us advance science to help figure out if these vaccines work. 70,000 volunteers during the year 2020. Amazing. What we know from those trials, we followed all those 70,000 people. We have all the data for 8 weeks of follow-up for all of them. In those 8 weeks of follow-up, there were no signs of serious adverse events that we can attribute to the vaccine. That's really important that they followed for 8 weeks. Why did they choose 8 weeks? They chose 8 weeks because we know from all the vaccine sort of research that's ever been done, vaccine side effects happen within 6 weeks of vaccination. So by following everybody for 8 weeks, that's exactly why the Health Canada and FDA insisted on that was the follow-up time, because they wanted to catch that time interval and go a little bit beyond it to see if there was any safety events to worry about. So I think the first thing to say is that the goal of these large trials is to make sure they're safe. And the experiments were successful. We proved safety. That's not to say there aren't side effects, but I want to reframe side effects for you as these are a sign that your immune system is responding, and that's what we want to happen. If we don't get an immune response, we can't get the immune memory, and the memory is the whole point of the vaccine. So you'll probably get a sore arm if you get vaccinated. Let's go to the next slide. I often hear concerns about whether things were rushed. And I think, Trump in his wisdom, didn't think about that when he called things Operation Warp Speed. So that doesn't give people faith that things weren't rushed. But what I want to really emphasize is that absolutely no steps were skipped in comparison to anything else that we would ever do to approve and make sure that a vaccine is safe before it gets rolled out in Canada. In fact, the trials completed for these two vaccines were about 10 times larger in some than the trials that we usually have to approve a vaccine. Usually we have 6,000 to 8,000 people in a randomized trial to figure out if a vaccine is safe and effective. And as I said before, between these two trials, we had 70,000, more than 70,000 people. The reason they were able to go so fast is that we had governments around the world collaborating in ways that never happened before. And in fact, prepaying for each phase just to get things up and running in that regard. But none of the steps were canceled or skipped. They were all completed. The other reason we were able to get this done so quickly is that it is and was a pandemic. And so during a pandemic, there's lots of cases of COVID-19 going on. And that means when we run the trial, we're able to accumulate the data a lot quicker than when we're doing a trial, for instance, for shingles. Let's go to the next slide. Oh, yeah. So often we hear questions about what about the long-term effects? And I want to repeat what I said before. Vaccine side effects happen within 6 weeks of the vaccine dose. The thing that we need long-term data on is how long the vaccine will help you for. That's still unknown. But whether the vaccine is safe in the long run, we can say with a great deal of confidence that it is, because vaccine side effects happen within 6 weeks, and we followed all the people in the trial for 8 weeks. Plus, we now have tens of millions of people who have been immunized around the world. And we continue to watch and wait and look very carefully for any signs of concern and make sure that if there are any signs of concern that are attributable to the vaccine, we will take action accordingly. So the scientists are watching very, very carefully. But I would just like to emphasize what we want long-term data on is how long the immunity will last for. Will we need a booster dose? That we don't know. Let's go to the next slide. So there are some people who should not get the vaccine. On the left are the people who absolutely should not get the vaccine. These are people who had an allergic reaction after the first. They should definitely not get the second. And there are people who have a severe allergy to something called PEG, polyethylene glycol. This is very rare. Such people would be allergic to Benadryl, to Tylenol, to other common things where we find this ingredient. You would probably know if you had that allergy. It is very rare. If you think you might have that allergy, you should probably you probably have an allergist and you should probably talk to them. Of course, if you have symptoms that might be COVID-19 or might be something else, you shouldn't get a vaccine because it'll confuse us as to what happens after the vaccine. Remember, we're watching everybody. We're waiting to see what the side effects are in the next million and the next 10 million people, and we're counting everything so that we know the stats. And so we don't want people who are currently sick getting the vaccine because it confuses us. And they also say that they don't want people who have had some other vaccine within the past 14 days to get this vaccine. That's mostly because, again, they don't want to be confused about the risks of side effects. And then, of course, children, we don't have the data yet, but those data will come later this calendar year. There are some people who we call special populations that require a little bit of added discussion. All right. You've heard, I'm sure, in the news about people having allergic reactions. The bottom line from the allergy societies is that you should get the vaccine, but you'll need to be monitored for longer than normal, maybe 30 minutes at the clinic. And if you have an EpiPen, you should certainly bring it with. There have been a number of cases, about 1 in 100,000 people have had an allergic reaction so far. Every one of those people have been fine. Every one of those people have been fine. We cannot say the same thing about every person who gets COVID. If you tend to faint when you get a vaccine, well, come and get the vaccine, but let people know because precautions can be taken to make sure you stay safe. You don't fall and hit your head. If you have a bleeding problem or you're on blood thinners, you should get the vaccine, but you will need to apply pressure for 3 to 5 minutes or have somebody else do that for you. If you're breastfeeding, you should absolutely get the vaccine. There is no reason to be concerned whatsoever. The Society of Obstetricians and Gynecologists of Canada and every other relevant society have encouraged this. There is no way for the vaccine ingredients to get through the breast milk and onto the infant. If you are pregnant, in most cases, you should get the vaccine. However, there may be some instances where you want to talk through what the different risks and benefits are. When you do that, your healthcare provider who's caring for you during your pregnancy will remind you that what we know for sure is that if you get COVID while you are pregnant, you are at very much increased risk for adverse events. So it's very important for pregnant people to get protected. If you're thinking about getting pregnant, there's a lot going on the internet about why you might be concerned about the vaccine. I would personally not worry about that at all. There's no theoretical or biological reason to be worried about how it could affect your fertility. Keep in mind, it does not affect your genome or your DNA. It cannot. And certainly having COVID and having long-term effects from COVID could affect your fertility. If you have an autoimmune condition or you're immunocompromised, in general, people should be planning to get the vaccine. There are some people who are on powerful immunosuppressants, and they should talk with their prescriber about the timing of their vaccine. This is all based on the latest guidance that the Ministry of Health has put out to all the vaccine centers, and it is revised from the initial guidance based on newest data. Okay, and then the other question that often comes up, should you get it if you had a COVID infection before? In general, the answer to that is yes. It's more a question about the timing. You probably have some immunity and you may not be as high priority to get it as others because you already have some immunity. Let's go to the next slide and we'll just try to wrap up. So where and when can you get the vaccine? It should be brought to retirement homes. And if you have a chance to get it, you should get it. If you have a choice of which one to get, ask for the one that's available first. They work about the same. And now we can move to questions and answers.
First of all, thank you for that information. Very, very helpful. I'm sure all of our guests would agree with me there. We did receive quite a few questions in the last couple of days for folks that were planning on attending. So I'm going to run through a few of those. And perhaps some of the items we touched upon, perhaps we may have to expand on a few.
Sure.
But just to start with, we're hearing in the news that second doses might now be delayed. If someone has already had their first dose, how does a delayed second dose impact the effectiveness?
This is a really good question. I think if we had adequate supply, there's no doubt in my mind that we would want to follow the protocol because that is what we know the most about. In the protocol, there was an allowance for 7-day delay. So that's never going to be an issue, delaying by a week. And in fact, some vaccine experts believe that delaying a little bit longer will give you a better protection in the long run. However, we see emergent data from Israel, and we see the data from the trial that says pretty clearly to us that until you have both shots, you're not getting a great protection. And so after you have your first shot, it is crucial that you basically pretend that you haven't had a shot. Even after you've had the second shot, right now we're saying that all the public health guidance needs to remain. But I think that we will be learning more about that and things may very well relax over time in that regard.
Great, okay. Question number 2 we have here is, you already covered off on pregnancy, but can you just revisit again any contraindications for people who are trying to conceive? Are there any special guidance around that?
So a number of people actually in the vaccine trials did conceive, did become pregnant during the trial period. No ill effects were seen. So we have very clear proof that it does not affect fertility. And there's no biological reason to believe that it could. I'll say again, if you're planning on becoming pregnant, that's not a reason not to be vaccinated.
Okay. All right, we're going to go through a few other questions that you've already covered off, so we're going to focus on the ones. Again, can you just confirm that there is no strain of COVID in the vaccine? That seems to be a very popular myth.
Yeah, and that came up just in the chat right now, so thank you for that. It's really important that if you have questions, please feel comfortable asking. There is so much out there, and it's very confusing to wade through it. And this is your chance. So please ask away. The Pfizer vaccine and the Moderna vaccine are basically the same in terms of their components. They have a little bit of mRNA, and then some lipids and some of this PEG stuff. They have they have nothing in it that sort of acts as a preservative. And that's one of the reasons that the cold chain that you would have heard of, that it needs to be kept so frozen. There's no preservatives or anything like that in it. There is absolutely no virus and no chance of the vaccines giving you COVID. It is impossible.
Okay. mRNA seems to be a bit of a hot button for many people. Can you share if that's been used in other vaccines in the last 10 years, or how that's been trialed, or other uses for it?
Yeah, that's a really, really good question. So we have not done mass immunizations for the public using, for the broad public, using mRNA technology for vaccines before. However, the reason they were able to develop these vaccines so quickly is because they have been working on this technology for more than a decade. Many of you would have heard of Anthony Fauci by now, so the sort of top doc in the States. And he often talks about how the mRNA sort of technology has been used for cancer treatments and for other sort of more, I'll say, focused vaccine populations like Ebola and things like this. But it is true, we haven't used it for, a vaccine that's going to go out to, tens of millions, or maybe even billions of people. But I can tell you that right now, we're at 35 million people that have had the mRNA vaccine, either from the Pfizer or the Moderna. And we're watching very carefully to see if anything untoward occurs. But I think it's been very promising.
Okay. We have a question here. What would happen if I were to experience an adverse reaction to the vaccine several months after receiving this? And this might be beyond the scope of the conversation, but what happens with liability? Obviously the government's the one who's telling us to take this, and so there's some questions there.
Yeah. So I want to repeat that we have lots of data for a very long time about vaccines, and what we know is that vaccine side effects are going to happen within 6 weeks. So I think the likelihood that if something untoward happened to you way down the road, that we could attribute that to the vaccine, it seems really implausible. Now, liability, that's you need to make lawyer money to answer questions like that. That's above my pay grade.
That'll be our next session.
But I think, I think what interests me is the health of the patients that I care for one by one, the health of my family, my community, the health of Ontarians. So, with that in mind, I have spent a lot of time poring over the data, more than just what was published in the journals, poring over the data that the FDA gets and Health Canada gets and so on. I honestly don't think there's anything to worry about in terms of long-term risk here. What there is to worry about is the long-term risk of COVID. And I would weigh that much more heavily on my mind.
Thank you. Another question. If you've had COVID already and you've recovered, is the vaccination still a good idea, and why?
Yeah, I tried to briefly address that earlier. The immunity that you get from COVID may last as little as 3 months. The immunity that you get from the vaccine will last much longer and may be more robust. However, if you had COVID for sure, you likely have some immunity. And as a result, it is reasonable for you to say something like, oh, maybe somebody else should get this vaccine ahead of me, especially at a time right now when we have such limited supply. Over time, by the time spring comes, we're going to have a lot of vaccine here in Canada, please God. By that time, hopefully it'll be a long time since you've last had your infection, and you'll be ready to be boosted for your immunity to last longer.
Okay. A question about allergies again. Can a person with an egg allergy or any food allergy receive the vaccine? Are there any
Really good question. So it is a no-no for you to get the vaccine if you have this really rare allergy to something called PEG. And as I said earlier, people who have an allergy to PEG would be allergic to Tylenol capsules and Benadryl capsules. So it's quite rare. People who have other kinds of allergies, the recommendation from all the allergy societies right now, the allergy and immunology societies right now, is that they absolutely can get the vaccine. But if you're the sort of person who has an EpiPen, you're going to want to bring your EpiPen to wherever you're getting the vaccine, and you're going to be monitored for 30 minutes rather than 15, just to be absolutely sure. And I'll say again, the rate of allergic reactions to this vaccine is about 1 in 100,000. So that's like, lightning bolt territory in terms of risk. It's super rare, but it can happen. And so, we're continuing to watch carefully and monitor in whom it happens. If you have an allergy to nuts, egg, soy, whatever it is, I don't think it's such a higher risk for you that you should not get the vaccine. But what they're saying right now is we might as well watch you for 30 minutes rather than 15.
Okay. Next one up here, we have, can a person who is infected but asymptomatic and unaware, so perhaps they don't even know they have it, receive the vaccination? And if so, are there any different side effects than if a healthy person receives the vaccination?
This is actually such a good question. Thank you for posing it. So if you don't know, and you have no symptoms, then you're going to say so, and you're going to be eligible for the vaccine. As we said before, if you have symptoms, you should delay getting the vaccine until you have no more symptoms. So I'm sure this has happened. Just by the by, we have 35 million people that have been vaccinated already. Probably more than that by now. That's the last time I checked. For sure, that has happened. My guess is that those people may get a sore arm, but maybe not. There is theoretical reason that if you had, for instance, the flu and then got the flu vaccine after that, there was a theory that said that you'd have a worse reaction to the flu vaccine or other vaccines. And actually in real world data that never really played out that theory. And that might be where some of this question is coming from. That theory remains prevalent on social media and stuff like that. The best data we have right now is that that's just a theory, but the data doesn't play it out.
Okay. How can we be assured of no long-term delayed negative side effects years later, generational children born to vaccinated parents? So it's a tough question, but it's certainly one that's on a lot of
I
people's
think
minds.
it's a really good question. Like in the past, we have been burnt. I think we should acknowledge that. There has been, people may know about thalidomide, for instance, where pregnant women were given things that affected their children, and I think it's right for people to have questions and worry. I can't say that enough. The reason I'm not worried about that in this instance is because of the way that the vaccine works. Again, this is a little bit of mRNA that gets your body to produce a little bit of this thing called spike protein. That mRNA dissolves very, very quickly, and the spike protein does too, but not before it primes. Oh, you can hear my children. Not before it primes your immune system to see the spike protein forever after. After minutes to hours, all that's left in your body from being vaccinated is your own immune response. So if you're going to have a long-term reaction to something that's not there anymore, that seems very unlikely. In comparison, when we think about things where we have long-term reactions and we want to watch out for that, we're thinking generally about pills that you're going to be taking repeatedly over time. In the case of thalidomide, it was the sort of thing where you're taking it during pregnancy and it can affect the fetus. In this instance, there's no reason to believe that the mRNA could cross the placenta barrier, that is, that it could ever get to the fetus. Even if it did, I wouldn't be terribly worried because, again, we all have mRNA. We all, every moment of every day, turn mRNA into protein. We don't normally turn it into spike protein, that's for sure. But again, the mRNA that you get injected with and the spike protein that it builds would get dissolved within minutes to hours. So that's why I feel very confident that, years down the road, it doesn't make sense that there could be something that mRNA could still be doing because it's long gone.
Makes sense. Okay. We have a couple of questions in the chat box here. The first one is, if the Moderna vaccine works off of the mRNA, how does the Pfizer vaccine work? I'm under the impression it's also mRNA.
It is.
And we've been told that it works like the flu vaccine, where the virus is injected so your body can build antibodies against it.
Yeah, no. So the flu vaccine is different than the Pfizer and the Moderna vaccines. Both the Pfizer and the Moderna vaccine are mRNA technology in the ways that we discussed. That's how they work. And amazingly, that's why we see the results so similar, because they're really, the same technology. Flu vaccine is different. These vaccines absolutely cannot give you COVID-19.
Okay. If the virus mutates, will the current vaccine protect against the new strains? And if not, can the mRNA proteins be modified easily to create other vaccines?
This is great. Was this a planted question? This is a great question.
Great job, Mohammed.
This is a really, really intelligent question. Thank you. The bench scientists, the folks who do, what I consider real science, not the science I do, which is about, quality improvement. They're watching this every day. They're running tests on different mutations to see if the spike protein itself has mutated so much that the way that we respond to the kinds of spike protein that the mRNA vaccines currently get us to make will still work. So far, things look promising in general, but they are going to continue to monitor. And indeed, one of the neat things about the mRNA technology is that it's a lot quicker to modify the protein that will then be made to match what mutations came about in that spike protein. So it is possible, yes, for them to, if necessary, change the vaccine and basically chase the virus mutations. The more COVID-19 that's out there, the more it has a chance to mutate. And so the main message I would give us is to hunker down a few months more until we can all get vaccinated so that the virus has less opportunity to spread and transmit and mutate.
Okay, thank you. Last question in the chat so far. Is there any data yet on vaccine for children?
The trials are going right now. So I can't tell you yet. What they're going to be looking at is how well children mount an immune response and how safe it is, of course, just as we look at in adults. It is normal. It is part of the normal process that they do, that they exclude pregnant people and children from these kinds of experiments. They always do things in steps. Some smart, ethical people decided that that's how it should be. And so it's not a cause for concern that this comes after. We do know also that children, thank God, are less likely to have serious adverse effects from COVID-19 virus. So we do have some time, whereas with older people, we were and are in a rush. And so we'll, I think, have results by summer in terms of the trials on children, but don't hold me to that. I'm not, I don't have inside knowledge on that. It's just what I've seen from talking with folks.
All right, thank you. We have a question regarding pet lovers. Can cats or dogs get COVID? Great question.
I have heard that they can. I have heard that they can. In fact, I saw some report that a tiger got COVID, but I although I always wanted to be a veterinarian, I am not one. So I'm not sure.
Either way, just keep your dogs inside. There we go. All right, we have another question here. What if they find that they have to modify the vaccine, but you already have had the original vaccine? Does that mean that you are no longer protected from COVID or the new mutations in this case?
This is a future-looking question. I don't know. We do know that we have to substantially change the flu vaccine every year because flu mutates so much. We don't yet know how much COVID-19 is going to mutate, or if it does, it can mutate all at once as long as that spike protein doesn't change all that much. So that's really the key, is that, and even if the spike protein changes, will our immune response from these original vaccines still recognize the mutated spike protein? So far, the answer to that is all yes. Yes, it looks like the vaccines are working with all the mutations we see so far. Could there be a time that we need to get a totally different kind of vaccine? Maybe, but we're way out of like what I know for sure now, and now I'm just guessing. So I'm getting uncomfortable.
All right, thank you for taking a stab at that one. All right, we have a couple more questions here that you might be able to have some insight on, but also we might want to call upon our director of HR to maybe comment on as well. Will getting the COVID-19 vaccine ever be mandatory for healthcare workers? So first, Dr. Ivers, from a broader perspective, are you hearing anything around that?
My hope is that nobody will need to make it mandatory, because the data are so compelling, and nobody ever had to make the polio vaccine mandatory, and the data at the time when polio was rampant was so compelling that people stood up to take it. And I think we've all lived through this pandemic. The vast majority of Canadians, if we give them a chance to get their questions answered, they're going to take the vaccine very happily. It's good enough for me and my family, sort of thing. I think it'll probably be good enough for the vast majority of Canadians.
All right. Kimberly, did you have anything to add?
I think maybe I can just add a few points. I have been hearing in industry and also within government that this is a conversation on, is there certain industries or positions that we're going to mandate it or recommend it strongly, as long as there's no other issues around you can't for your health for religious reasons or various other factors. But we're not there yet. I think it's still up for conversation. Different countries are in different places. So from the Canada perspective, right now it has not been mandated, but that could change at some point in time.
Thank you. A question that's somewhat related. What restrictions will team members who do not get vaccinated face in the long and the short term at work?
I might just add, there are some things where already some industries are mandated. So I think Qantas has talked about mandating vaccination in future. So that's an airline that flies to Australia. So there are folks that, I think some organizations will choose to do that or not. But again, I would really emphasize, like, if you have a strong medical reason not to do it, that, please talk to your doctor. If you have questions that did go unanswered today, please, email somebody so that you can get them answered. Email your team and they'll send it to me. I'm an email away.
Mm-hmm.
Great. That wraps up all the questions we have so far, and I'm not seeing any new ones in the chat. So before we wrap things up, I'm just going to give folks kind of one last chance to post a question. Again, it's fantastic that we have Dr. Ivers here in spite of our technical hiccups. So I do know that we're winding down on the hour. It looks like people have had their questions answered, though. So Dr. Ivers, I can't thank you enough for taking time out of your day and out of your evening and away from your children. Oh, Mohammed's got one more. Look at that. Sorry, another great question. Does getting a vaccine protect those around you from contracting it if you had?
Yeah, I'm sorry I didn't mention this before. So the transmission question is a really good one. I'm glad you brought it up. Most experts believe that when you get the vaccine and you have adequate immunity for yourself, you will not only protect yourself, but also you will stop or slow transmission. We do not, we're not announcing that in public yet because we don't have the results of the studies to test that yet. But we know from every vaccine that created immunity in people before, that's what we saw. So I feel very optimistic, but I can't stand on strong on 2 feet saying, yes, for sure, it will stop transmission until we have that data.
And you expect that to be shortly? Right. Okay.
Yes.
Great. Well, given that we're almost done with the hour, I'm going to have to wrap things up now. If anyone else does have questions, please don't hesitate to reach out to your community directors. We will continue to collect the questions on our end. And again, Dr. Ivers, thank you so much for being a resource both this evening and even going forward, and for taking time, as I was saying, out of your personal schedule to help us out tonight. We really appreciate it. And to everyone who's joined us today, thank you for also joining us this evening. Stay healthy, stay safe, and we'll see you next time. Thanks, everyone.